Her feet are to my right, and her arms are folded sideways, so she's facing this way. So we have the left side up, right side down, and we're now ready for our OLIF. In the anatomy, and points, it shows you on a virtual projection exactly where certain parts of the anatomy lie deep to your skin incision. So what I'm going to do is mark out on the skin exactly where the L4-5 disc space is. Your marker. So that's the back of the L4-5 disc space. And mark out, which is what I'm doing right now, on the skin, where is the L4-5 disc space? So I can now start to see what's my virtual projection going to be on both the coronal, which is the en face view, and the axial view and the virtual X-ray view. Yep. So now we're making an incision in the left lower quadrant. It's right above the pelvic brim, kind of where your belt line would be. The aponeurosis of the external oblique. Or give me a hemostat. And what I'm doing now is I'm just working my finger. I'm doing this all by feel. I can do it with my eyes closed. And I want to just pull back the peritoneal bag off the posterior abdominal wall. Pull the ureter forward, which is in that. So my wand shows there that I'm more than posterior enough. Now you can see my tip is in the sort of anterior quarter, anterior 20% of the psoas, and it's on the anterior part of the spine. I'm going to angle back just a little bit and move down just a little. Now you can see where my dilator is going in. Back of the wand. Okay, so there's my wand, and it shows my probe is pointing a little too anterior in the disc space and a little too inferior. So I'm going to tilt towards the pelvis, and I'm going to drop my hand so it goes towards kind of contralateral foramen there. So now here, you can see the yellow line on the top right is going right down the disc space, and on the top left is sort of in the anterior third of the disc space, not aiming into the spinal canal, but aiming towards the other side of the vertebral body, the other psoas. We don't want. So what I'm trying to make sure is I have nothing between my soft tissue like a ureter or a vessel, and my wand here confirms that along with visual inspection. I think it's less experienced surgeons, give me one of those silver ones, they just spend a lot of time looking and looking and looking, and they're never sure where they're at. Once the retractors are in place, it's an easy operation. But what you can see is that this is annulus, so that's disc, okay? That's where you enter into the disc space. This is down by the feet. This is towards the head. This is psoas muscle, where it's attached to the front of the spine. Okay, this here is retroperitoneal fat, and in front of that is colon. What's also pushed forward down here that you can't see is ureter. So that shows the back of my discectomy. It's a great spot. Don't want to be any further back. Okay. That's the back of my discectomy right there. But we're not through the psoas there. We're pulling most of that psoas back. Okay, this is the front of my discectomy. I don't want to go any further forward than that. Let's go take a look in where I was touching though. I'm looking on the exoscope now. Here, so this is a long knife. It's going to cut right into the disc space. By the way, so now Audrey's telling me she's getting a response. That means my nerves are back there. It's really quite comfortable. And now I'm just doing the discectomy. We're going to have a series of instruments that we're going to follow through on. I'm going to see if I can move this up. Will help get some of that disc out to there. Mallet. We call this the uterine forceps, or curette. I think I remember using it in OB-GYN in medical school. That's why we give it the name. So I'm following it on navigation to make sure I'm down the disc space and that I am not going through the contralateral nerve, slap hammer, navigation. And we are directed very nicely. And that feels even better, I think. I gotta help myself. Back of my annulotomy. It's a great spot. That's inside my disc. Annulotomy is basically the opening into the disc. And then there's the front, which is great. So you got starting to tighten a little bit. So now I want to check, make sure I'm in my disc space. Mallet. Go to the stealth image. Those black lines are the front and the back of my implant. So I know it's in the disc space. It's not in the spinal canal. It's not too far forward. It is pretty close to perfect. With about 10 cc's of blood loss, you'll lose more getting a mole removed. And it's because we're going through avascular planes.